Hi, I'm Dr. Efi. I'm here to answer the question, what is a breast cyst? A cyst is a fluid-filled sac that is within the breast. It is quite common in women that are premenopausal. In the postmenopausal state, we tend to see it in women that are on hormone replacement therapy. A lot of people have cysts, but they are not aware that they do have them. If they are going to present, they will often present as a lump that shows up sometimes spontaneously, usually cyclical. They can be firm, mobile. Some of them are tender, some of them are not. What causes cysts? What we do think is that these are related to hormonal changes in our body. Cysts can vary in size. Some of them are so tiny, 2 millimeters. Some of them are quite big. The size of the cyst itself is not necessarily reflective of whether it's painful, because I've seen some cysts that are quite small, but because they are so tense and fluid filled, they are quite tender. On the other hand, I've seen cysts that are quite big and they may be a nuisance to the patient, but they're not necessarily tender. What happens if a cyst is tender? Does that mean you have to live with it? Absolutely not. What we can do is something called a cyst aspiration. What that means is I take a needle, I put it in the cyst, and I take out the fluid that's in it. Are cyst aspirations painful? I would say that it really depends on the patient. Pain tolerance varies from person to person. Do I always submit the fluid that I take away from the cyst to the lab to get tested? No, I don't. Cysts tend to have a typical appearance. The fluid can either be clear to yellowish, tea-colored, green, blue, creamy, milky. Those are all spectrums of normal. If it is red, I will definitely submit it. If the cyst looks in shape or maybe there's some solid components in it, yeah, for sure I'm going to send it to the lab to get tested. Are cysts cancerous? Most cysts are simply benign growths, just that. Especially when a cyst is described as being simple. That means it's just smooth, it's just fluid filled, nothing fancy. If, however, there's a complex cyst, which means that I look at the cyst and yes, there is fluid in it, but there are also solid components in it as well, I will aspirate that and I'll send the fluid. Depending on the situation, case by case, I may also, quite likely, biopsy the solid components as well and send to the lab. So in ending, I mentioned that cysts are benign. Do they become cancerous? Not typically, especially if it's a simple cyst. Like I mentioned, if they become more complex with solid components, it doesn't always mean that it's cancerous, but we pay closer attention to this. That being said, if you do have the symptoms that I talked about, let's say you have you're premenopausal, have a lump that comes up, it's painful, it's mobile, please don't assume that it's benign. Still go and see your primary care physician. They'll give you a requisition for an ultrasound where we can then go ahead and confirm this. So if you have any questions, more questions about cysts, please drop me a line and I'll answer below.